hear next from Jennifer Yeates. She's going to talk about the challenge that we're facing in keeping drugs out of the hands of our kids. So Jennifer is a Colorado native. She's a mother of 3 teens, and she's been involved in local regulatory policy to advocate for strict nicotine and marijuana protections since 2014. So you get the time frame again, right? Things happened in 2012. She's passionately worked to educate and inform folks on the importance of protections for kids, and was one of the earliest supporters of statewide youth protections when recreational marijuana became legal in Colorado. She joined One Chance to Grow Up in 2020, which is an organization dedicated to being the sole voice for the health, safety, and well-being of kids in Colorado after the legalization of marijuana. Please help me welcome Jennifer Yeates.
All right, good morning. Glad everybody's here. So I'm going to follow along here on my screen with the slides here, and hopefully we've got everything coming up here. So marijuana was legalized in Colorado in 2012, and Governor Hickenlooper appointed a task force to recommend policy and implementations on Amendment 64. In doing that, customer experience ranked #1 in their list of priorities. The impact on kids was such an afterthought that in one hearing, a member of the committee said that biodegradable packaging was more important than having child-resistant packaging. So in that, our mandate was set. Although, and we still thought that kids' futures and the public safety should be put before marijuana profits. We are funded by everyday citizens, and as well as private foundations, and we don't take any funds from the marijuana industry. And we've always felt that the more voices that are in this arena, the better. And so we're happy to help in the background as long as, and let others take the lead whenever it's necessary. And we came together in 2013 as Smart Colorado, and we for 10 years have been the sole voice dedicated to kids. We don't take a position on legalization for adult use, and we're a nonprofit, nonpartisan, citizen-led organization with 10,000 members from every state and 54 community partners and experts. And in 2020, we transitioned to One Chance to Grow Up because as marijuana is legalized throughout the nation, we felt that there were lessons to share with all. As far as the why, most of us have been had personal experiences with family or children that have been negatively affected by marijuana use. We feel that there's dangerous misinformation gaps that exist around marijuana. Legal, commercially sold marijuana is perceived as safe and regulated. Many parents, educators, policymakers don't know that the weed that they remember is different from the products that are actually available today. And today's high-potency THC is having significant and serious negative effects on today's youth and kids. This is a national crisis, just not sure the nation knows it yet. And as Colorado was the first state one of the first states to allow recreational use, the local, state, and local policies that we have are warnings, or things that we need to share along with the warnings and lessons. And I'm sorry, I'm very nervous up here, so I'll get into it here in a second. It's been a while since I've done this. And this are our originally founders were Henny, Gina, and Diane. And then this is Henny sitting at a hearing, I believe, for House Bill 1317. And because One Chance to Grow Up is funded by private funds only, we are not beholden to state grants, and we can speak as we like and participate fully without fear of repercussions in committees and rulemaking. And that is a lot of what we do. And then, so here I'm going to give just a little background. I think a lot of you are aware of the products, and Luke went through a lot of the things, and some of the information I have is the same as what he was showing. But we use the term THC products a lot because marijuana and cannabis no longer really covers what's being sold in the commercial market, but the terms are also used interchangeably. So delta-9 THC is the psychoactive compound that's found in the marijuana plant, and that's what actually gets somebody high. It can also be extracted to create numerous other THC products. Stepping kind of sideways from the legalized marijuana market, the 2018 Farm Bill included an amendment to the Federal Controlled Substance Act, which excluded the hemp plant from the definition of marijuana, provided that it contained no more than 0.3 concentration of delta-9 THC. Delta-8 is found naturally in hemp at very low amounts, but it affects the brain similarly when inhaled or ingested. And delta-8 can be extracted from legal hemp through a commercial process, chemical process, or synthetically created in a lab from CBD. And CBD is the non-psychoactive compound in marijuana that you see sold in everything from lotion to gummy bears in retail stores and online. Hemp-derived products, including delta-8, delta-10, and HHC, are sold outside of the legalized marijuana model, and they are an area of legal ambiguity nationwide. And these products are easily obtained by those under 21. Depending on the state, they are handled differently, or the state has just kind of ignored them all completely. And I bring this up only to show how things change so quickly, and sometimes unintentionally. And unfortunately, tomorrow there'll be more new and different products that we'll need to be concerned with as well. So it's not a stagnant issue. It will always be changing. So that was just kind of a side note there on the delta-8. So for the regulated THC market, high potency THC products come in all kinds of different forms, from vaping and dabbing, edibles, drinks, eye drops, nasal sprays, inhalers, topical body products, lubricants, and even suppositories. We've purchased legal products in 9 states, which can all be seen at thcphotos.org. These particular products were purchased in Washington dispensary. We have candy, pretzels, soda, chocolate chip cookies, rainbow belts, malt balls, and most of these products are in 10-serving packaging. So these products here are about this size, relatively speaking. So in these are regular Doritos. This is 1 serving. When you put this into the marijuana packaging there, it would be 10 servings. So there are 10 pieces, 1 serving each, equaling a total of 100 milligrams in most of these. And different states, again, have different rules and regulations, but just wanted to give reference to the size there at the top. Products come in all kinds of deceptive packaging. The pills, the little love, bliss, and genius there make you feel happy, smart. And then there's a little vape pen in the crayon package there. These are a couple of vape pens. These are nicotine, but again, they are very similar to the marijuana market. And with the kids, you can't really tell, honestly, without looking hard at it. And then the last thing there, those are like the old-fashioned pixie sticks. It's basically THC infused sugar. And then one more thing I have here, this is an empty bottle here, but this is 30 gummies that are 30 servings. So imagine a kid opening this and eating just one. The potential is terrible. Ugh. I've got too much going up here. I can get rid of that now. dabbing has become an epidemic among Colorado youth. Colorado addiction psychiatrist Dr. Libby Stout says comparing yesterday's marijuana plant to the extreme THC products now available is like comparing the coca leaf to crack cocaine. And this isn't going to play. This was a video, but I don't think it's going to play. It doesn't have an icon to play there. But
this is dabbing, a more potent and increasingly
Sorry.
popular way of using high THC pot. Just a hit is 10 times stronger than a joint or higher. So popular, it's hard to keep up with the nicknames. Honey, honeycomb, shatter, butter. The dab is the gooey or hard substance placed in the glass, then lit with a butane torch. If you want to know more about this, just ask your kids.
so that is a little scary there. And hopefully, there we go. So in the dabbing, this is just a piece of shadow there, and then examples of serving size. There is a Colorado State educational resource. It's now required to be given out at the dispensaries with each concentrate sale. And that little dot that you're seeing up there is this dot right here. That is a serving size, or says the state of Colorado. Pardon? Exactly. So, and then it all depends on consistency of potency and the percentage of potency, and so it's kind of very vague in what it is, but again, just a reference for size. This is actually a Delta 8 product, but the same thing is sold with wax or shatter or butter or whatever they want to call it. It's about a $50 size container, has a little bit of sticky gooey substance in it, and you use that at that serving size. This can be purchased for about $20, which isn't very much. I'm not sure how they make it for that much, but there's a lot of servings in here. So again, that's what's available to our kids. And so our kids believe that they are safe, and that's because these products are aggressively marketed and sold as medicine. Colorado young people have significantly increased their use of dabbing, vaping, and edibles since 2015. And the percentage of kids that are just smoking a joint have decreased dramatically in favor of other delivery methods. Misperception of youth by youth. From the 2021 Healthy Kids Survey, kids think their friends are using marijuana more than they actually do. So in a way, it's a good thing. They're not using it quite as much, but other kids think that they are using it more. 16.7% of middle school students think half their class used marijuana in the last 30 days, when actually only 3% responded that they had. 39.5% of high school students think half their class used, when actually only 13.3% responded that they used in the last 30 days. Also in that same study, youth use in general of marijuana decreased from 2019. This possibly is the only upside to the pandemic, where lockdowns, remote learning, and social disruptions saved some of our kids from beginning or continuing use of marijuana, nicotine, and alcohol. And the goal would be to keep that number lower. I mention nicotine and alcohol only to point out that use of all of these substances declined during the pandemic. And I think that's an important point when somebody uses that and says that marijuana use has decreased. So I think it was a result of the pandemic, personally. And public perception is also different from, what Luke had stated. Decriminalization and legalization that I think a lot of people thought they were voting for back with Amendment 64 is very, very different than our full-blown profit-driven commercialization that we now have in several states. And then commercialization has led to an explosion in THC potency. And while some claim that the CBD in marijuana may be the medical cure-all which we all again heard when Amendment 64 was coming through, it appears that the real money is in the more addictive, high THC potency products that come from that marijuana plant. And why it matters, the Colorado Department of Health Department findings on youth impacts shows that weekly use is associated with deficits in learning, memory, math and reading skills, and decreased IQ, failure to graduate from high school or finish college. Kids are more likely to experience psychotic symptoms as adults. They may become addicted. The good news is that treatment can decrease use and dependence, and quitting can help regain some of those deficits. Supporting our kids with recovery is paramount for their success as adults. They do not need to be punished. They are victims of an aggressive marketing, including advertising and influencers on social media, which we all fall victim to from time to time. European health experts concluded that THC potencies above 15% should be considered a hard drug like cocaine. And nearly 93% of all products found in Colorado in 2020 were over 15%. And I think Luke's slide said 97, so again, that varies depending on where you're at and what you're finding, but there's very little low potency products available here in Colorado. High potency is linked with 3 times the risk of psychosis, and for those that use it every day, it increases to 5 times. My slide's a bit off there. And in that same study, it showed that low potency, which they considered less than 5% THC, showed no risk for psychosis. And that may be why you never heard about it back in the day when the average potencies were below 5%. But now that's all changed. Commercialization is also harming disproportionately neighborhoods of color. Commercial grows, THC manufacturing facilities, and dispensaries are often concentrated in neighborhoods that are already facing inequities, including poverty. And additional impacts are that vehicle fatalities where marijuana was found in the driver's system increased 138% between 2013 and 2020. 69% of marijuana users said they had driven under the influence at least once in the past year, with 27% admitting driving high almost daily. And a survey of 400 Colorado dispensaries found that 69% were recommending marijuana to pregnant women. And the science is clear. There is no amount of THC that's safe for pregnant women or the unborn child. Teen deaths. Marijuana is the number one subject, or is the number one substance in toxicology reports in suicide for 2020 for those under 24 years of age. And with the added increase in suicides in general, that's really a scary fact. And the problem is that the laws and regulations have failed to keep up with today's marijuana. And so how one chance to grow up makes change is we try and educate. We've had hundreds of meetings, briefings with schools, community groups, local governments, and even Colorado State Department of Revenue, which is the department that regulates marijuana. We've participated in several state and local committees. We've had many successful and some unsuccessful involvement in initiatives to help cities stop initial marijuana commercialization. We speak to parents, trusted adults, and educators, and all that care about kids. And we use media to provide sound and accurate information. Hundreds of our media stories, opinion pieces, and paid media advertising throughout Colorado, DC, and other states that are in the process of legalization. And we offer thcphotos.org as an unbiased, realistic source of products in the legal market. It is no longer just a plant. And so all the products that we've bought in the 9 states are all on THC Photos. And then we're changing policy through trying to put safeguards in place. And over the 10 years here in Colorado, we've secured a number of safeguards, which they all need to be approved upon, but you take what you get sometimes, and everything helps. So every little bit that we add to protections helps. And that includes product testing, labeling, packaging, which includes THC potency and warning, required edible markings, serving sizes and package limits, pregnancy warnings at the point of sale, data collection on youth impacts. We helped add 150 additional behavioral specialists in our schools, funding for education and research, including a THC potency report here in Colorado. We've helped with advertising requirements and limits, important delivery and on-site club restrictions, reducing home marijuana grows, and limiting the number of hours, distance requirements, schools, and outlet density. And again, that all varies from the state and city to city and county to county, but everybody has their own levels there that, and a lot that we've helped with. This was a billboard for back in 1914, and it's kind of appropriate now that we're coming back on Halloween, and with a lot of those products, you can't tell one from the other. And so we've had a lot of successes in policy changes, but success is just the tip of the iceberg. Much more child protection policies are needed. And when working on change, the word compromise is up towards the top, because never has the first draft of a bill been passed into a law. There is an absolute need to recognize that you will not get everything you want the first time around, and that's not a failure. This is sometimes hard to push through, and that's where perseverance comes in. Relationship building, we have over 50 coalitions on our list that would not have been possible back in 2013. It was 9 years in the making. And every year more and more people are willing to talk about this and willing to pitch in and help, and that is the goal, to keep improving on that end. And belief in a mission and a cause. Our mission is kids, and that has helped us stay focused and not get distracted. And we believe that as much as personal opinions may differ, everybody should be able to agree that kids should not be using marijuana and need to be protected in that. So that's where we come from there. So as far as a Colorado example of success, through data collected in 2020, we established that most 18 to 20-year-old medical marijuana patients did not need marijuana for any medical condition prior to them being 18 years old. But at that point, hundreds of Colorado teenagers register for their medical marijuana card when they turn 18, kind of as a rite of passage. And HIPAA allows the high school students to do this, to see a doctor and obtain a register card without notifying their parents. And this process takes minutes, literally minutes. There are 70% more 18-year-olds than 17-year-olds. 83% of these report severe as a qualifying condition, which can't really be proved or disproven. And a large number of our high school seniors are or turn 18 during the school year, which allows for a pipeline of product into our schools. Oh, sorry, I'm behind on my slide there. But this shows here the percentage of, in 2020, 265 licenses or registrants under 17, and then it jumps up to almost 4,000 for those over 18. House Bill 2113-1317 we worked hard along with a lot of our coalition partners, a lot of other voices in this space. But out of that came potency research, review and additional regulatory measures that will be determined by the University of Colorado School of Public Health. Hopefully the first part of that wraps up soon, because some of that information has to be reported to legislators in January. The first ever mandated health warnings to be given out at the point of purchase is what I showed you earlier with that serving size. So there's warnings and information in here. They're supposed to be given out. The problem is making sure that it is given out at the dispensaries when they sell. So it's kind of the next step of enforcement there. There are health warnings now required on advertising. As far as the medical marijuana, 2 physicians are now need to recommend medical need for those under 21. Additional training is required for doctors recommending marijuana, and the reduction of the daily purchase limit of marijuana concentrates has been reduced. And along with that, real-time tracking to prevent medical dispensary hopping, which means anybody, but students in particular, when we're talking about the medical marijuana, could go buy their limit at one store and then go from dispensary to dispensary, however many they could hit in a day, buying as much as they possibly could, and then that potentially would be funneled into our schools. So with a tracking system on that, hopefully we will see that change. And then the last thing is there is a now required toxicology and data collection for all suicides for anybody under the age of 25. And we thought that information was important, and hopefully collection of that will lead us to more helpful avenues that we can take. The bill did pass overwhelmingly in the House and unanimously in the Senate. We had 50 Colorado organizations that signed on to support, including the largest school districts, Colorado Children's Hospital Colorado, Centennial Institute, and numerous other healthcare organizations and youth-serving nonprofits. And more than 100 people testified, including brave parents telling harrowing stories of how high THC marijuana products harm their family. And that really is the key, as far as I'm concerned, is getting people to tell those stories, but they are hard stories for a lot of people to tell. So. So the bill went into effect January 2022, and these results are from May 2022. There was a 46% drop in medical marijuana sales and a 27% drop in 18 to 20-year-old patients. So these statistics confirm our claims that there was abuse in the medical marijuana market, and it will hopefully continue to improve for the duration of 2022 and then going into 2023. We rolled out our education campaign last month via social media, and we'll continue to push it out. And this is something, and again, we are funded by personal funds and foundations, and so the more donations we get, the longer we can push out this campaign. But use of marijuana concentrates may lead to cannabis use disorder dependency, mental health symptoms, uncontrollable repetitive vomiting, and possible psychotic breaks. So these are in the black box text that's kind of used as in the tobacco industry. And then for those of you who don't know, the cannabinoid hyperemesis syndrome, which is also CHS, is a condition that leads to repeated and severe bouts of vomiting. I mean, very severe, kind of non-stop, every few minutes, to the point of going to the emergency room. And it does occur in some daily long-term users. And these are some more warnings that are all being pushed out via social media. Some of the same warnings that went through on the other ones, plus just stating that the FDA has not substantiated any of these claims. Concentrates are not recommended for those under 25, and that marijuana stores cannot provide medical advice. And then along with, oh, that was the last one. Then along with that new campaign, we have our marijuana free zone that we use to hopefully identify and establish, clearly identify designated marijuana free zones for families, kids, community members, working with Colorado schools, rec centers, churches, and other organizations where they can display these on their front doors to identify those areas. And we're always excited to have new members to that. So if anybody's interested in having their organization post those stickers, that would be great. It adds to the effort. Boys and Girls Club of Colorado with 64 clubs, and Denver Public Schools middle and high schools were some of our first partners in this. So part of our goal and our mission is to is that we want states that are legalizing today to start with regulations and policies that meet or exceed where Colorado is today, not where Colorado started 10 years ago. And a national bill is one path towards accomplishing this. And at a minimum, we feel that national safeguards should include the same things, a lot of the same things that we already have in Colorado, but more on a standardized level to make sure, again, that those states that are new start where we're at now. And a case in point is we were working with South Dakota, and we had a real hard time getting grassroots, youth-oriented organizations because they didn't know what they didn't know. And so it's hard to convince them when they don't realize what full-blown commercialization really looks like. But again, child-resistant packaging, restrictions on types, shapes, and flavors, which includes cartoon characters and gummy bears and all of those kid-friendly colors and shapes. Labels requiring disclosures on pesticides, chemicals, solvents, and metals used in cultivation and product production, because you would be surprised how many chemicals are out there they use in all of this. Mandatory pre-sale testing of all those things and recall authority, standardized government health and safety disclosures and warning labels, and funding for a nationwide public awareness campaign towards kids. And in my mind, that's the most important thing, because you have to educate everybody before you can actually get them involved and make them understand how important these things are. And so what you can do is sign up with One Chance to Grow Up or any of our other partners that are in this space and care about kids and care about their communities, and donate to those same groups. Urge your elected officials to better support our kids. Talk about the harms of today's marijuana with anybody who will listen. And then follow us and our other partners and voices in this space on Twitter, LinkedIn, Facebook, and all those social media platforms. And the best way to predict the future is to create it. So we have to be a part of the solution. And then my email is up there. I also put Julie's email up here at onechancetogrowup.org, as she is our donor and community liaison and point of contact for any additional information that you might need. And she's usually the one that does these presentations, but she wasn't available today. So, but thank you everybody for being here, and thank you for caring about our kids.